Well, this year, more Americans are retiring than ever before, and millions of them will start using Medicare. And that's according to the Alliance for Lifetime Income. Well, CBS News business analyst Jill Schlesinger joins us now, and she says people receiving government insurance still need to plan for major out-of-pocket expenses. Jill, good morning. Okay, so how much can Medicare recipients expect to spend on their own?
We've got a new report from Fidelity that reveals that a 65-year-old who's going to retire this year can expect to spend an average of, get this, $165,000 in health and medical expenses. That's over the course of their entire retirement. So it's a long period of time, but it's up 5% from last year. It's more than double than the amount when they first started doing the survey in 2002.
Incredible. So, okay, how does this $165,000 number break down?
Well, you know, what's interesting is we've got just the regular old premium from your Medicare Part A and B. That's 43%. Then you actually have a 10% cost for prescription drugs. But when you think about all the co-pays, the co-insurance, deductibles, that's accounting for a whopping 47%. So you can see how the numbers actually can add up pretty quickly. One thing I should mention, these numbers do not include any costs that someone would have to pay for long-term care. That's because Medicare does not address long-term care, and it's hard to figure out who needs it. So just think of it this way. If you are married, that 165, that 165,000 number is double because the 165,000 is per person.
Okay, that really puts it in perspective when you look at it that way. And obviously, this makes us all think about how do we plan ahead? So how can current workers plan for these big future costs?
You know what people like me do? We scare you with the big $165,000 number. But then we break it down, and it'll be a lot easier when I explain it to you this way. When I pull that number down, I say, okay, it's 20, 25 years. What is it per year? What is it per month? So what I really want people to think about is that you'll need to add $600 per month per person in today's dollars as you think about your future expenses. So maybe you're a family and you say, oh, we spend $2,500 a month. Just add $1,200 to that to cover your 25-year retirement. So to save for these future costs, I recommend that people who have access to high deductible health plans with health savings accounts use them. They are tax efficient. Now, the good news also is with an HSA, you can use it for decades in the future when you retire. What if you don't have access to a health savings account? You may want to create a separate account that is earmarked for health care. Think of this as a form of bucketing, where you say, I want a specific account for a very specific purpose. Whatever your method is, just know you're going to have to account for this. This is not going away. So I want people to just know you can break it down and make it easier. Of course, we know when you start earlier, the numbers go down. It's a lot easier to do it sooner rather than later.
Yeah, and I'm glad you said it sounds scary because that's what I was thinking. Jill, I want to take you with me to my next meeting with my financial planner so I really can have a handle on this. Always so good with your information, Jill. Thank you so much. You can catch her regularly on CBS Mornings and the CBS Evening News with Nora O'Donnell. For more analysis, always go to JillOnMoney.com.